Hey everyone, welcome back to When Words Don't Come Easy. I'm Justin, and if you listen to episode 1, you know this podcast is all about my dad, Roger. That's me, and his recovery after suffering a stroke that left him with aphasia. We talked last time about the moment everything changed, what those first days in the hospital were like, and what it's meant for him and for our family to learn to communicate in a whole new way. Today, we're going to zoom in on a key part of that process: speech therapy. And I'm not talking about in the abstract. I'm talking to the person who's been sitting with my dad, working with him, pushing him, supporting him, and celebrating every little win along the way. His speech therapist for the past 6 years, Carol Graiwer. So today we're going to hear her side of the story and how she got into the field, how speech therapy actually works, and what it's been like working with my dad through all this. So let's start from the beginning, Carol. Not with my dad, but with you. What made you want to get into speech therapy in the first place?
Okay, so I had two reasons of getting into speech therapy. One was that my youngest one was in the last couple of years of high school, and I knew I wanted to do more with my life. And the second reason was that my mother was a stutterer who never got help for the stuttering, and my mother in law had had a devastating stroke. And because they had pushed for her to regain physical ability. They never really addressed the speech aspect of it, and she
Uh-huh.
just slowly was fading away because she couldn't communicate.
So you saw that and you felt like there could be
Right.
more
And
that could be
so
done
I
here.
saw that, and I just I decided that this is something I wanted to be able to do.
And you didn't just get into speech therapy in general. You work with speech with stroke survivors, and which is heavy work. And so working with your mom is what gravitated you towards that,
I never worked with my mom.
or what happened to your mom.
Yeah, but that did grab it. Yes, but I also work not just with adults. I also work with kids,
Oh,
and
okay.
so for me, it's a question that communication is the way that we all interrelate in this world, and if you cannot communicate properly, then you're losing out on so much, and people discount you because of
Exactly.
your speech impediments or your speech problems.
Yeah. And I imagine every patient's completely different.
Yes,
Yeah.
yes, and every stroke patient that has aphasia is very different.
So I gotta ask, what was your first impression when you met my dad? What was going through your head?
But honestly, this is not because your dad is sitting next to you. I thought your dad was a great guy, and it said a lot to me when I first met him. Your mom came to that first session,
Uh-huh.
um, and they had a complete like little notebook that showed me what he had already had up to that point with a different speech therapist. So I could see, where your father had come from, but I also felt at the time after talking to him and with your mom that I also felt that he had so much more that he could offer and so much more to go.
But yeah, I think like that's what a lot of people don't realize is how much personality actually goes into it. Like you're also reading the room and like just getting my dad's personality, my mom's personality. It's not just the by the books.
Well, I'm going to also throw in you into the mix. What was it, Roger? Well, it's 6 years, right?
6 years, correct.
And we still get phone calls in the middle of our session just to checking up on you in the middle of the day.
I do still check up on him.
And you
Pretty.
still check up on him. But that, for me, that goes a very long way in a positive because that shows me somebody that has a family that's putting in the time and has the concern and is looking out for their loved ones.
Thank you. So, well, let's get into the nuts and bolts of this because I think when most people hear speech therapy, they picture something for kids, maybe how to pronounce their R's or maybe someone helping an actor with an accent. But with aphasia, it's obviously a total different ballgame. So, what is speech therapy for someone specifically like my dad?
Okay, so speech therapy for somebody who has aphasia, who has had a stroke, is on many, many different levels. And because it all depends what type of stroke that was that they've had, I can narrow it into your dad has what's called anomia. or anomic aphasia,
Okay.
which is anomic aphasia is that it's a word finding issue. Okay. And so because it's a word finding issue, then you have somebody who knows what they want to say, but has difficulty getting those words out properly. And, look, I can even use an example
Yeah, please.
today, if you want me to.
Yeah,
Today,
sure, definitely.
okay. Your dad, but Roger has been complaining for the last 2 to 3 weeks of having a back pain.
Yes, he has.
Okay. So
I've
when he
heard about
came
it.
in today, I asked Roger, I said, Roger, how's your back? And he told me he did get it out that it was no better, wasn't good, and he was still in pain. And he said, he's going to and then when that was it, he was going to and I said, okay, you're going to get an x-ray. No, he was shaking his head. No. Okay. So he kept trying to get it. Okay. I said, oh, wait, we talked last week you going to the acupuncturist? No. You going to the physical therapist? No.
Keep going. I know where this is going.
Roger starts putting his hands and he's doing like this. and I finally said, wait, are you going to the chiropractor?
Exactly.
And he said, yes, so, and that is very common with somebody with aphasia, with anomia, with anomic aphasia.
Specific.
That they know what they want to say and they can't get the word. The problem that happens with somebody with anomic aphasia is that you could have had this same conversation with your father and he could have said chiropractor without any problem. And you would think, okay, he's fine. And that's what happens many times in families, that once you have the word one time, families don't understand why you do not have it every time. And so the frustration becomes really high level because on both ends, on the patient's end and on the family end, because the family doesn't understand that it's not a delineated straight line. It doesn't happen like that.
Right.
There's days it's up and days it's down, and that's a major problem. That's a major problem for families and for the person who's had the stroke.
Exactly. So and like you said, with my dad having anomic aphasia, it's not just a one size fits all with all the different types of aphasia. Would you be able to kind of go over the different types?
Sure. So the probably one of the worst type of aphasia is called Broca's aphasia. But nobody really has to remember all these names for what it is. But with somebody who has Broca's aphasia, they cannot form the sentences, but they also even have sometimes difficulty understanding if somebody speaks to them in a complete sentence. So they have comprehension problems. Sometimes, not all the time. The worst, I think, though, I mean, that's considered one of the worst because it's a lower end of the scale. But the worst, in my mind, is somebody that's been diagnosed with what's called Wernicke's aphasia. Because in Wernicke's aphasia, you can speak clearly. None of the problems like your father exhibits, but they understand almost nothing what other people say to them. So the families, well, if you can sit here and have a conversation and tell me anything you want, why can't you ever answer a question?
Yeah.
Because they don't understand it.
Are they able to
really hard?
Are they able to comprehend reading?
No, so they can't. Yeah,
no.
They lose when you talk about speech therapy and you talk about aphasia. What people have to understand is that aphasia is just not the talking; it's the understanding. It's all aspects of communication, and so so that's what becomes more problematic.
So what are some tools or strategies that you use in a typical session with my dad?
With your father?
Be nice.
Okay, I gotta be nice.
Yeah, gotta be nice.
Okay, so your father, I mean, let me, let me go backwards.
Yeah,
Before
yeah.
I directed straight onto your father, which I will do,
Uh-huh.
I as the speech therapist have to be able to determine, even though somebody is in my room with me having difficulty talking to me and explain, and where we can carry on what's called a fluent conversation, I have to be able to determine would, before the stroke, would that fluent conversation have taken place, and at what level would it have been at? So for your father, there's no question in my mind, before the stroke, he was what you would describe in speech therapy as extremely high functioning, that there was no problem with understanding,
Mhm.
no problem with expressing himself. Your father is also very much into what's going on in the world around him. So a typical session when we start is, we find out how his week has been. He tells me from, you know, and in that week, telling me about how his week has been
Yeah.
can be that the Dodgers won, or what the Kings hockey team was doing.
Yeah.
We
Yeah, totally.
we talk sports. We argue about basketball because we have different favorite teams there. And then your father's also, we also then go into conversational speech. We'll talk about what's happening in the world.
Uh-huh.
We'll get on
And
political
those are all
discussion.
just tools for you. It's not just a conversation. You're actually you're
Right.
helping with just
So right. So we're having the conversation, but in that conversation, I am using the tools that I have to help him express himself. But at the same time, when I say that I'm trying to help Roger express himself, what's really important and is for families to recognize also is not to put the words in their mouth. So that even if he's stumbling, we can sit there for a couple minutes until either I notice that Roger's frustration is really high, and I have to give him more of a clue of what it is, and then and then if we're lucky, we hit it correctly,
yeah, we
and
can
then
I
after
I
we have
definitely see that side of him when we get to that point. Sometimes
yeah,
he doesn't want me to help him, and I
right,
know exactly what he wants to say, and he says,
right,
Don't
no,
say it."
and absolutely you should not, even if it takes him 10 minutes, which normally would have taken two.
Right? Right?
Gotta you
Uh-huh.
gotta let him, or anybody who's had a stroke. You've got to let them uh, try to get the words out themselves, and
Right.
then after we do that, we then uh, I have a couple of therapy books I use. I have a program that your dad, a lot of your dad's problems are that, or I should say Roger's problems. A lot of Roger's problems are with reading
Mhm.
and getting
Yep.
words out.
That's my hard
So,
part. Yep.
right?
I
So
agree.
I have programs that he has to read for me, and then some of them are that he has some work that he has to do immediately after he reads something. He has to respond to something. Um, Recently, what I've been doing is Roger's got a lot of problems with words that he can't distinguish when he's reading between a B and a P and
Yep.
a D. Okay, and I did some testing for Roger recently. He's got problems with words that have what's called a hard C sound, the cuss sound. So I put together a whole story on Clayton Kershaw
Okay.
and how
Good
he
one.
got his 3,000. And Roger had to read a 2-page story, and the story was just full of the cuz and the
Uh,
buzz and the peas, and it was
Oh, it was
sweating,
and
that was a pain. Yeah,
yeah.
that was a hard one. That
But
was hard.
but at least it was about the Dodgers and Kershaw.
and we did one with. I think the hardest though was Otani's when we did
Yeah.
with the
Yeah,
Dodgers. Otani.
yeah.
So somebody else I would never be doing this with. That
Gotcha.
would not be for somebody else.
Uh-huh. Yeah. So
I have other people that have uh, the word and aphasia that I work with, but they're not getting the same that I'm giving to Roger,
right.
because Roger is based upon what is going to keep him engaged and keep him wanting to communicate.
Exactly. Yeah. I mean, at the beginning, it was obviously for us as his family to see the progress a lot quicker because we saw him go from not speaking at all, not reading
Right.
at all, to now, past few years, he's kind of, he's at a
Getting
level,
there. I'm
and
getting
he's still getting better and better, but it's harder to see the progress. So, as his therapist, uh, how do you see like when someone's making progress when it's not as obvious? Yeah.
Hard even as the therapist to say it. There, how do I see it? Like with Roger, at an end of a session, Roger will sometimes sit there and say to me, "Hey, I'm so frustrated. That was so bad. I couldn't get the words."
Yeah, it's down.
And I sit there and go, "No, Roger, I thought you had a really good session today."
I know. I always do that to you. I always say to you, I didn't do really well today. You're always saying, no, you did great.
You did great because, I'm not saying that I count, but let's just say if last week he had 10
Yeah.
10 times that caused him problems, to me, if we get 9, we're doing great. We're doing great. And it's very hard to judge, but it's as long as we stay on an even path and there's no regression.
Right.
Because therapy doesn't end at, it used to be that people would say, okay, the books, when I first started,
Yeah.
the books said, you got to get it within the first 18 months. You don't get in the first 18 months, people aren't going to recover from it. Well, in the 25 years, they've learned that was wrong.
Exactly. Yeah. I mean,
And
that's what we've been told from the beginning.
you can continue to improve. Like you said, the biggest growth does occur in the first 18 months to 2 years, but after that, it it still continues. And you want to make sure that you don't have regression.
Exactly. And so, like, I'm sure during some of his sessions, has there been like an aha moment for you where you're like he's definitely like, he's getting
It's
there.
getting there.
Like, this is,
Oh yeah,
or has there been several? I don't know. Like,
yeah. And I've had a few aha moments.
yeah, where he caught you off guard. I don't know. It's just something that
Yeah,
really stuck.
yeah. You know, uh, I guess it was, when was it? Probably I'm saying maybe 3 weeks ago. Roger came into the office and like I said, we have different teams that we root for in basketball.
Right.
And he came into the office and said, "My God, your team, Carol, did really good on the trades.
Yeah.
You got to have a
Yeah,
good
mine.
team." And he was right there. He started the conversation.
Mhm.
You know, I was still I was still thinking, were they good trades or not?
Yeah.
But he
You're
was
like, what?
telling me all the reasons why I should be a happy camper.
Uh
So that was a really good moment,
huh.
from him, from his point of view,
Uh-huh.
my point of view of thinking of Roger
Right.
with his speech.
Has there ever been anything that's really like, because I know my dad and I know he can be kind of stubborn. Has there ever been anything that's really frustrated you with him?
No,
No. Okay.
Wow.
probably. I
Wow.
mean, and that's not unusual. Honestly,
Uh-huh.
I have had, not just with Roger,
Yeah.
I've had other clients come into me from strokes or even when we talk about aphasia, it's not just stroke people that get it. Somebody who's had a traumatic brain injury will
Mhm.
have
Yeah, I've done
aphasia
research on that.
also.
Yeah.
Okay,
Uh-huh.
there's ways. I had somebody that has primary progressive aphasia, not from a stroke. The brain is just giving off the same signals as if it did have a stroke. Um, so it's the families that get the frustration. Um, uh, I I don't know if, I mean, Roger, you can answer this. I don't know if he feels that in your I from a couple of my clients I've heard that they feel like I am not judgmental and therefore they can be open easier without the frustration, because when it's the family, they feel like sometimes the family is expecting them to do better than what they can, and that causes some of the frustration. I don't know.
No, I don't. I mean, when I'm with you, everything is pretty straight ahead. I
Right.
don't. There's no real frustration with me. Well, I do have the frustration when I'm
Right.
trying to
But
talk.
you have
Oh, yeah,
can't talk
yeah,
sometimes.
and I can't talk,
Therefore, we get one of
and what
these.
happens when I exactly, my hands will go up and
Yeah.
everything, yeah, and I just can't. I get that's when my frustration really comes through.
Right.
If I don't get something really quickly, then my brain just kind of freezes, and then the next word and the next word and the next word never come, or
Right.
it comes. It doesn't come easily. Let's put it that way. I like. Do you ever think at any point that that I'm not going to be needing speech therapy, or is this something that that should happen for as long as as long as it should happen?
As
Question.
long as you're around.
Yeah.
I think, I believe that if an individual wants to continue with speech therapy, they should continue for as long as they're wanting to do it and willing to put the work in. It's, to come to me once a week and never put the work in, because I give Roger homework every week.
Right.
You get homework every
Oh,
week.
he tells
And
me he,
when we're in
when I
office,
talk to him on
yeah,
the phone, he says, "I'm doing
we're
my
in
homework."
office, we
Yeah.
have to do work. Okay. And if a patient's not willing to put the work in, then yeah, therapy can end. But if you're willing to put the work in and you and somebody feels that they are benefiting, I definitely believe that they should continue. Um, the problem is the insurance companies, and it's going to get worse probably before it gets better,
Uh-huh.
if anything.
I know, it's really
Um,
sad, yeah.
because insurance companies believe, uh, you know,
You hit a certain
they're
margin.
there to
Yeah.
restore, and they decide how much speech is restorative, right?
Yep.
But it's not. It's maintenance also, because I'm going to use Roger. I'm going to, obviously we're talking with you. I mean, Justin, you maybe noticed this. We had 4 weeks of me, right? I wrote 4 or 5 different appeals to the insurance
Uh-huh.
company where we had to stop therapy
Right.
recently.
And
Yeah.
I think I think I lost.
Every
I lost.
talk,
Uh,
right.
yeah.
And every time I talked with Roger, it was a little less than what it was the
Uh-huh.
week
So
before.
it really is maintenance, like you said. It's if
Right.
uh-huh.
And they were slipping. And that shouldn't be. Somebody should not be have to go backwards.
Yeah.
Especially people that, we've put money into insurance our whole life, and then when we want to use it, they tell us
Exactly. Yeah.
that they turn you down.
Terrible.
Okay, I don't believe in that,
Yeah.
and so I try my hardest to push, and we were successful.
Yeah. It took you 5 times to do it. Yeah.
God, it took 5 times, but we got success with it, right? And hopefully they're not going to bug us when I have to do it again, because I'll keep bugging them again.
Yeah. But this is
So,
what. Yeah. This is what
you know,
happens, though.
And I can hear you like getting emotional about that. So I'm kind of move forward and go just in general, I know like this job, it's obviously like, a very intimate job. You're not just just with somebody one on one for 1 hour a day. As with my
right.
dad, you've been with him for 6 years and I could tell that you guys have a great relationship. So I gotta ask, emotionally, I mean, does it take a toll on you? Does when something happens to a patient and they go backwards, I mean, does the work come home with you?
Um, I, I, I tend to get more emotional on the upswings than I do on the downs.
Mm.
I've been, and by that I mean, um, if somebody's, like doing this and not get, I just say, okay, we got to push harder. I have to figure out how to get it. And those little wins, is why I do this. I
Exactly.
do this because, having somebody be able to tell me they had a conversation that they couldn't have had 6 months ago
Yeah.
is a positive.
Exactly, and I'm sure
And it's
hearing from a family member the improvement, that's gotta make you feel amazing. Yeah.
right, exactly.
Uh-huh.
And let me this might be a good time or not in the conversation. The patients that I see that I have seen over 25 years and that I see, the ones that get the most improvements are the ones that have the family support or a significant, if it's not family. I have another patient of mine who has his best friend drives an hour once a week.
Wow.
He was doing twice a week to do his homework with him,
That's awesome.
to take the strain off of his wife, that she was dealing with everything
Yeah.
else that he was going through.
Uh-huh.
And, he comes down and he does it. So it's,
It takes a community.
those are the people that improve.
Uh-huh.
Those are the people that improve. The ones that have people behind them that aren't criticizing.
I mean, yeah, exactly.
Yeah.
And that's where the frustration comes to me. So when you ask about frustration, my frustration is on those family members that do not step up to the plate.
Right, right. When you see that they could be doing more.
Complain that their loved one is not getting better and they do nothing to help. And if anything, they make comments, going back to what we talked about before. Well, he does, he can talk. How come you're telling me he can't understand me?
Yeah.
Or, I had another patient, which I told Roger about, who had really very severe stroke. And he could answer yes, no questions. And his family kept asking him open-ended questions and wondering why he wasn't giving them answers. Well,
Yeah.
he couldn't give answers
Exactly.
because he didn't have words.
Really.
But if they had asked him yes, no, and to the point one time that they even yelled at, I've had two different patients with this situation where when I said something to them, I said, "Oh my God, you're going out of town. You're going to go visit your son,
Yeah.
you're going back to see your family." And I didn't know you had family that lived here. And like I said, there's two different families, a little bit different situation, but both of them turned to me, and both of their significant others turned to me and said, "What, the caregiver told you?" I said, "No, he told me." He doesn't talk. How can he tell you that? I said, "Well, I asked yes, no."
You asked the right
And
question.
I watched his hand, and I knew you had a kid that lived. It kept pointing. So I said, "Oh, you're going on an airplane. You're going to go visit?" And they look at me like
they never took the
I'm not
time to
telling
learn
you.
the tools.
And the rules are
Yeah.
and it's a yes, no.
Exactly. It's as simple as learning that.
They had never done the yes, no. There's a possibility that language could have expanded beyond yes, no, but they never did it.
Have that happen.
Yeah.
Oh, so before we wrap this out, I want to ask you,
Sure.
what's one thing you wish more people knew about aphasia?
Three things. One, that just because you can't talk doesn't mean that they don't understand everything that's being said to them, especially somebody
That's the most frustrating thing to me.
You get discounted. People, they get discounted because they can't express it back, but they're getting everything that was said to them. So that's one thing I think they have to know. The second thing is that you have to keep trying, and you have to keep pushing to the next level, and never being satisfied that, oh, it's okay because I'm speaking a little better than I did, but it's okay. If you're not speaking close to what you used to be speaking, it's not okay. At least for me, it's not okay.
Yeah, exactly.
And that the more the family is involved, it's how you're going to maximize positive outcomes.
Exactly, especially like what you're saying with the families. I was gonna say, do you have advice for families that maybe just had a sibling or a loved one go have a stroke and they're just getting introduced to aphasia?
So yes, so if they just had a stroke,
or like you said, a traumatic brain injury that now they have aphasia.
Right, a brain injury, a stroke, they have aphasia. First and foremost is to start speech therapy ASAP, not to wait. Going back to what I had mentioned about my mother-in-law, they thought, okay, well, let's get her hand working better. Let's get her walking better. And then we'll worry. Well, everything's got to be done as quick as possible. I'm not saying not to do all the physical, but definitely not to let the speech go. So you have to start immediately, And you have to make sure that the therapy is just not confined to 2 sessions a week, because that's pretty much what insurance will pay for. So it's not confined to just 2 sessions a week. It has to carry over into daily living, and as much as you love the person who's had the stroke, um, or the brain injury, the person who has aphasia, you have to let them stumble through making mistakes. It doesn't do anybody any good if you're always putting the words in their mouth, because eventually their brain just shuts down. They don't want to talk.
Yeah, no, I
They
hear what you
don't.
mean. Yeah, exactly.
Yeah. And like I said, and that therapy is not just limited to what happens in a therapy session. It has to happen pretty much all the time.
And so, like, also, you might have some other resources, like some books or websites or apps for them to use on the computer, probably like right away.
You're right. So here's the thing. Dr. Google is good and bad at the same time, because there's a lot of misinformation. And so if you go on the websites, you're going to get exactly what I referred to. You're going to get where they said if you didn't get better within the first 18 months, that's it, people. You're going to find that still out there. And so
the P word, plateau, which there's no
right.
plateau.
And so right. And so then the family says, okay, we're done, not doing this anymore. And so and yes, I do use websites a lot to get information from. I use one with Roger. In fact, that the one we use with the news.
Right, the news,
called
yeah.
3-minute. It's a 3-minute news program that's actually specific for people with aphasia, and it's little 3-minute articles. Roger has
I
to
have
read
to
them
read
out
with
loud. We ask questions about it afterwards. Ask and answer questions. So, there are a lot of positives. I'm not saying there isn't, but it doesn't work for the patient when they're home and they're around people that somebody's just putting that iPad in front of them. The human interaction is the best way to get your speech back.
Exactly. Yeah, using your voice, basically.
Using your voice. You use it, you don't use it, you lose it. And that's not just. And here's the thing too, 100% Justin using your voice, but that voice includes reading, writing,
Yeah,
not just speaking. It's the whole package of communicating. And so, I mean, even some of your dad's homework has nothing. You would think, why am I doing? Why is he doing this? What is this? This is got nothing to do about him talking more. To try to find out, there's 10 differences between one piece of paper and the other piece of paper. Can you find the 10 differences? Well, that's stimulating the brain, and that's stimulating the crossover that we need from one part of the brain to the other part of the brain, which is how we talk. But so this is doing it in a different
Yeah,
way.
because there's always because whenever you give me homework, there's always different types. There's always different types of homework. It's
nothing's the same. Yeah, you got different worksheets.
Yes, Roger gets frustrated when he gets a certain type of homework. So I try to be. I was nice today. We were going to do this. He didn't get it today.
Oh, I got good ones.
Next week,
I got ones I like.
Next week it's on.
Yeah.
Okay. Well, so before we go, I just would really like to say thank you. You've been a massive part of my dad's recovery, and being able to listen to you and the way you've described everything, your communication and your patience and the progress that you've helped him get. Thank you so much. Seriously.
Well, let me also say thank you for the interruption every time you call, because
I mean, I check in on him here and there throughout the day. Make sure he's doing good.
No, that's one thing. I will say that with my family. My family is always with me. They're always calling me. They're always talking to me. So that again helps me speak. It helps me talk.
And that's what I'm thanking for, because that makes my job so much easier. Because I know sending that homework home, someone's going to see
Yep.
it and someone's going to say, "Did you do it?"
Exactly.
Or either that or my dog is going to eat it.
Oh, I'm sure you've heard that one.
or Roger has come to me and with one of the type of homework, and he's come and said, "Your mom." So he said, "Bonnie really likes this. We have extra for Bonnie. I don't want to have extra for her."
She likes those types of problems.
Well, you do that
Yeah,
too.
I've been over before, and I've
Yeah.
been like, "Oh, let me fill that out for you."
Yeah, try to figure it out.
Exactly.
You
And
know?
sometimes I can't, and he does. So
It becomes it's a family affair.
And that's why having the family do stuff
Uh-huh.
like that, because a lot of family can say, "Well, he can do it with his stroke. It's easy," until they actually sit down and try to do some of it, and they go, "How did he get that and I didn't?" You know?
Yeah.
So, so that's good.
Well, thank you again. So that's it for this episode of When Words Don't Come Easy. If you're liking the show, go ahead and follow or subscribe. We've got more conversations coming, more stories, and more breakthroughs. Until then, take care of yourselves and be patient with the people you love.
Thank you, Carol.
Thank you.
Thank you, guys. And that was beautifully said at the end there. Thank you.